Makoplasty is a type of total hip replacement surgery that utilizes robotic technology to assist the surgeon in placing the components that are utilized to replace or resurface an arthritic hip joint. The procedure starts with a CAT scan of a patient's pelvis. From that CAT scan, a virtual three-dimensional model of the pelvis is recreated. And before the surgery starts, we plan exactly where we want the components to be positioned in that patient's pelvis. Now, in the operating room, we utilize a robotic arm that the surgeon controls, but that robotic arm helps guide the surgeon in terms of the placement of the components exactly according to our preoperative plan. Well, really, any patient who's a candidate for total hip replacement surgery in general is a candidate for a Makoplasty-assisted total hip replacement. So a patient who suffers from arthritic hip pain that's interfering with their quality of life and activities of daily living and has failed non-operative treatment is a candidate for total hip replacement and utilizing the Makoplasty technology to add to the precision and accuracy of what we're trying to accomplish. When performing traditional total hip replacement, a surgeon assesses various landmarks in a patient's pelvis and places the components according to his or her interpretation of those landmarks. Although the results of traditional total hip replacement have been excellent, it does introduce the possibility for human error. A recent study from the Massachusetts General Hospital in Boston, one of the flagship Harvard hospitals, looked at how often surgeons actually place the components within what's considered an acceptable range of the sweet spot of ideal component position. What they found was that those fellowship-trained hip surgeons placed the components in an acceptable range approximately 50% of the time, which means the other 50% were in less than ideal position. The real goal of Makoplasty is to help avoid that human error and really add to the accuracy and precision of what we're trying to accomplish, because we know the most important thing we can do in the operating room is place the components as well as possible. Typically, after a Makoplasty hip replacement surgery, the patient is up the same day of surgery, at least taking several steps with physical therapy. The physical therapy continues the next day, and a patient is able to put all their pressure on that leg after the surgery. Typically, a patient is able to walk at least 300 feet with a walker or crutches by the time they leave the hospital in 1 to 2 days, and they may require an assistive device for the first couple weeks. By 4 to 6 weeks, most patients are walking without a cane and returning to their routine activities of daily living. Well, the two most important variables in terms of how long a hip replacement will last is, number one, the materials of the hip replacement, and we think there have been dramatic strides in terms of the improvements of the quality of the materials. But the second most important variable, as we've discussed, is how well the components are put in place. So we think with quality components and materials and ideal component positioning, I think there's a good chance that Makoplasty hip replacements should last upwards of 15, 20, even potentially 30 years.